Hey, here with Dr. Jon Heyer, one of my favorite doctors, and I don't say that about everyone. He's outside of the Chicago area, and what I respect and admire about him most is that he stays connected. He's so absolutely committed to his growth, his practice, his life, and he's a contribution. And in many ways, both from what he shares on group calls, but also creating a great video voiceover tutorial when it comes to functional medicine uh, fees, packages, and how to do that, which many doctors struggle with. So, Jon, thank you for your contribution, and I'd love for other doctors to hear some of your insights on getting the most out of the program. So, just to start, is what would you first recommend to get the most?
Sure. Yeah, thanks for that question. I think the two places I would start is just jump in. It's kind of like swimming. The best way to learn is to just jump in and go for it. You have phone calls every week, and I think that's a great place to begin. Even if you don't want to contribute to the conversation or ask a question, just to sit in. And you're very cool if somebody messages and says, "Hey, I'm just listening." You don't put them on the spot and make them uncomfortable. I think starting with the phone call, because you go over a different topic every week, and then you go individually with each doctor or provider or participant. And I think you can learn a lot from not only you, Josh, but from the other doctors as well. Because if somebody has a question, somebody else probably has it as well, and it opens the door for conversation. And it's always good to get a couple different opinions on how one doctor does it, maybe on the East Coast compared to the West Coast compared to the Midwest. The second suggestion I would have is just watch your videos. And you don't even have to take notes. Just watch them, just do a cursory review, just to see what the system is like. And then what I did is I went back a second and a third time, and I printed off the transcripts and made myself a little 3-ring binder, and I took my notes, and literally the 3 principles and the 6 questions, I just printed that out and carried that around in my pocket for like a week until I really owned that. And then you can go back a second and a third time, because this is not really practice management. And please don't take that wrong. This is doctor management. This is doctor mindset management. And from that springs forth how your office is run. This is not like other management companies. Look, if somebody's joined your group and they're not doing the work, there's a good chance that they had a bad taste left in their mouth from another consultant, like I did. And I was looking for something different. And the first coach I had literally gave me a 3-inch thick 3-ring binder of scripts and procedures and said, "Here, go memorize this and your staff." And not only was I overwhelmed, but it didn't fit me. And I've been to seminars with other coaches. What they say on stage sounds good. And when I talk to them privately and I ask, "Hey, my practice is different than yours. Will this work for me?" "Oh, yeah, sure. It'll work for any technique and practice." And when you look at it closely, you realize if you don't clone yourself and become like that guy in the pinstripe suit on stage, it's not going to work for you. This is not one of those. And if you've joined, it is different. There is work involved, but it's not brain surgery. The nice thing about it is it's not technique dependent. It's not even discipline dependent, because I'm a chiropractor, I do acupuncture, and I do functional medicine. And your principles cover however I approach care with my patient. And I say this respectfully, even if an MD joined your group and took your principles and applied it to their medical practice, not only would their practice soar, but their satisfaction rates would go through the roof, because it's not about manipulation or coercion. I have a friend who's heavy into these coaching groups and how to close them and how to sign them up for a year of this and just arm twist. And I'm like, yeah, he sees 250 a week, but he needs 30 and 40 new patients every month because they're getting in and then they're escaping out the back door. And this system is really more about building a rapport with the patient, finding out what their goal and what are they really looking for, and then accomplishing and working towards that. So, and then there's other docs I know who kind of bounce from management group to management group thinking the next one is going to be the miracle one, and yet they're not putting effort into the one they're currently in. And one of the things that you teach us, Josh, during our day one questions with the patient is to get the patient to understand, if you keep doing the same thing you've been doing, you're going to keep getting the same result you've been doing or been getting. It's Einstein's definition of insanity. Getting the patient to understand they need to try something different. And doc, if you're bouncing from one management group to another and you're not putting any effort in, this isn't going to work either. I'm just going to be, you got to put in the work. And it's not difficult, but there is some work that needs to be put forth. And it is such a mind shift that I actually would go into my exam room and my report room and practice it. And it wasn't that I had to memorize a script. It's that I had to retrain my brain to ask these questions and really get an understanding of where the patient's coming from. You asked, how have I applied it? Well, I have your book, You Deserve It. And I've bought several of them. And I do give those to new patients as a thank you and welcome to the practice. But one of the smart things I did was I actually looked through my patient list, and patients who've been with me 10, 11, a dozen years, I actually just hand wrote them a note, said, hey, Joe, hey, Elizabeth, I was thinking about you, wanted to appreciate you. I thought you might enjoy this book. I got a lot out of it. You might too. And the thank yous that have come back, I mean, that was worth it alone, because these are people who've been customers and trusted me for a dozen years. And they're like, none of my other doctors have done something like that. And I guess it's just taking that mindset and applying it to the patient. So how is the live different than this? Well, for starters, you're going to learn how to do the deserving process. And you can't do that in a phone call. And yeah, you can go over it in a video, but it's just not the same. It's like watching a concert live or on CD, right? Don't get me wrong, love music on CD, but a live show is a completely different experience. And so is going to a live seminar. It's a completely different experience. And since I took Alexis down to St. Louis and we went through that deserving process, she's been doing it too.
And Alexis is your front office CA office manager.
Yeah, she's been doing it as well. And so it's one thing to get my headspace right. It's another thing to get your staff's headspace right. But it doesn't just stop there. You can actually, and I've kind of tweaked this, and this is kind of my slant on it. I actually apply this to the patient as well. And I don't have time to do a 20-minute deserving process with them on the table. I only have a couple minutes, but I just cut to the chase and I'll ask them. They're coming in on day 2, their 3rd, 4th visit. They're getting used to the flow, and I'll ask them, so Joe, tell me 3 awesome things in your world today. Or Sally, tell me 3 things you're grateful in your week this week. And either A, they'll have an answer for me right away. B, it might take them a minute to come up with something. Or 3, they're negative Nellies and nothing's good. And having practiced for 20 years, I have a better understanding of where they're going to be and how long this is going to take. Because you can adjust them or do whatever you're doing, but if their headspace is in the wrong place, you're going to have a harder time. And I ask them that question every time they come in, to the point where the patient will sometimes say, Doc, I knew you were going to ask me that, and I was thinking of that on the way over, and I had a good one for you, but I forgot it. I said, you know what? That's okay. I appreciate the fact that you're thinking on it, and tell me when you think of it. Better yet, the next time you get in the car to come visit me, I want you to start thinking of it on your car ride over. And what it does is it starts putting a positive slant on coming to my office, because they're thinking of positive things. They're anchoring it with the car ride to my office. And then when I reaffirm it here, touching them, adjusting them, here in the practice, you're building those neural links to have a positive experience in the office.
Perfect. And it's funny, John, because I mentioned before we started the recording, like, here are the 5 points I just want you to quickly hit on. And you went through all of them. I was expecting to ask you each one. Like, you just remembered them. It just shows who you are, and also already going into like teaching. And I love the fact that you asked them those questions. And literally, I mean, you know this just from the neurological standpoint, if they're thinking about what's really positive in their life or what they want from a grateful perspective, while they get the adjustment with that input, with that neurological input and reset, that's making a difference too. So I love that you're adding that in. Last thing for a doctor, again, they have all this open to them. You said, get on the calls, start staying connected. You don't have to ask a question, but you know what I talk about each week, there's going to be a reason it hits you. what else would you say is most important to just dive in first? Would it be doing the deserving process? Would it be the 6 questions? Would it be like, what do you think is just, what makes the biggest difference for you?
Honestly, it's going to sound more simple than it is. Listening. The reason I could answer your questions is because I've become a much better listener, which is really what the 3 principles is about.
Mm.
And whether it's in my practice, I've become a better listener, or even in my personal life, I've become a better listener. And I guess the first thing I would say is, besides watching the videos and jumping on the call, is turn that squawking noise off in the back of your head. Turn that chatter down and just shut up and listen. Because I've been out 20 years, and I've seen this, I've seen that. I mean, I could come from a place of, I already know all this and all that. But if you're on a coaching call, if you're working with a coach, wouldn't it be better to just listen to what they have to say and learn to become a better listener? And I've used that not only with my patients, but in my personal life. So practice listening.
Beautiful. Jon, thank you so much for who you are, your contribution. Anyone watching this, I hope they get to meet you, and I look forward to the next time I get to see you in person. Have a great day.
You too as well.